Welcome, everyone, and thank you for being here with us today in this webinar, Outreach Promising Practicing, Lessons from the Field. I'm the senior project manager here in Health Outreach Partners, or HOP, for Margaret Anderson is with me, who is going to talk more about the project. We're very excited for this seminar because we have a big group of invitees that are going to share their practices, outreach practices with everyone today. So we hope that what you get from this, all the different ways of how can you share your outreach help. So the ones that have been doing this work, and for the ones that are starting a program of outreach program.
Health Outreach Partners, HOP.
HOP is an organization in Oakland, California, that is supporting all the programs, outreach programs, white nation, and gives more health to all the communities. Our mission is partnering with local communities, organizations across the country, and sustainable to improve life quality for people vulnerable and that are not well attended. We serve community health centers, social health organizations, and primary care associations. We have different resources in our website. And Sonia has shared this on the chat. Please go to our website if you're interested in more resources in regards to the outreach program. Here you have our agenda for today, and the seminar, it's going to last 90 minutes. We're going to start with the welcome and the presentation that we're making in this moment. And then Margaret is going to share a description, a general description of the outreach promising practices. That is why we're here today with you. After that, our four participants are going to describe their practices, and you would have the opportunity of doing some questions, and we're going to finish with an evaluation. During the webinar, we have three basic objectives. Learning objectives are: you're going to receive information about 3 to 4 successful outreach practices and strategies implemented by organizations serving the farm worker community. We're going to exchange recommendations with the panelists on how to overcome key implementation challenges during outreach with farm workers. Identify at least 2 effective outreach strategies that could be implemented in their organizations. And here my colleague Margaret that is going to explain about our project. Margaret. Thank you, Liam. Good afternoon or good morning, everyone, depending on where you are now. Thank you for being with us today. Margaret Anderson. I'm the manager for projects HOP. From January, my colleagues and I have worked with the National Center to document all the practices for the farm workers, and we're very excited of sharing this work with you and hear from the incredible teams that we work with during this project. To start, I'm going to describe why are we documenting all these practices, and I'm going to share a general overview of the project. And then how do we document this for the community, farm workers, before our panelists present their practices? Why did we wanted to document all these for the farm workers? The outreach is a very important part for services, and it's multifaceted, and it has a great variety of practices that are outreach. So we wanted to document all these variety of practices and how all the strategies utilized by organizations that help farm workers can be applied to another organizations that work with these communities. In these last months, HOP and NCFH have been connected with another organizations across the United States to know about their outreach practices. And as part of this recruitment, we shared through email to connect with them, and we use all the webs that have already existed to share the voice. We also shared a criteria that I'm going to share later. We interviewed and documented 10 promising outreach practices of farm workers serving organizations across the US from January to July of this year. Each practice has been in a profile that describes the practice, the information, and some important considerations for another organizations that want to implement the same outreach farm work in practices. And all these profiles would be described as an informed, general information that would be during this published during the fall of 2022. The criteria, as I mentioned, the outreach can include a lot of practices, and it's hard to measure all the impact that the outreach can have in a community. We started with the use of the criteria that you see here to help identify some practices that can be promising. It can vary to different criteria in the population, resources, geography. And we realize that it's not always that practices include all of the criteria here. So we established these criteria at the beginning, but the programs didn't have to fulfill all of them. Although some of the criteria that are important in this list were the needs that every practice respond to the needs of the community, replicability that was so important that another organizations to the service to the farm workers can implement this practice to serve their communities. And with this being said, we had the opportunity to document all of 10 different organizations. 4 of them are here today as panelists. And before hearing these panelists, I want to thank to all the organizations that were so generous with their time and with their experiences. Next, please. Some of the outreach promising practicing we learned a lot from Mixteco, who expanded the vaccine against COVID-19 to farm workers through local testimonials. We spoke with Family Health La Clinica. They leveraged a regional coalition to create a coordinated COVID-19 response for farm workers in Wisconsin and Vecinos. They have opened it to the Latin community in North Carolina. We learned also from community health centers in the Central Coast, which is an organization that developed a community of education about COVID-19 and other health topics adapted especially to their community. Virginia Garcia Memorial Health Center, an association that create access to medical services. And we learned from Vista Community Clinic, a clinic that created a program that responds to all the needs of farm workers along the US-Mexico border in San Diego, California. We learned also from Campesinos Sin Fronteras. It's an organization that established a practice of a long-term practice to connect with farm workers that cross the border between Arizona and Mexico. And we spoke with Fernando Molina. He founded Peace. He created a curriculum of a popular education about foster emotional health. And our colleagues from NCFH that developed farm worker outreach protocols for consideration. And we learned a lot from the Guatemalan Maya Center that created innovative text messaging strategies to reach indigenous communities. We are very fortunate to have the opportunity and speak with all these 10 organizations and learn from them. During our Inform, we're going to present more about their practices. Today, we're very excited to have 4 of those organizations to share their practices with all of you. After all the panelists present their practices, we would have a Q&A session. You can send your questions through the chat during the presentation. We will respond to all the questions during a Q&A session. Our first panelist is Emma Torres. She is the co-founder of Campesinos Sin Fronteras. Welcome, Emma. Good morning. Do you hear me, everyone? Thank you for this invite. It's an honor to be part of this initiative and to be selected as one of the practices that we do to outreach all the farm workers in Yuma and all the communities that surround in different states. So I'm very happy. Thank you. Let's start. I don't like to put a picture for me, but they requested for these. Here we are with our mission. And our mission in Campesinos Sin Fronteras is we are agency with promote self-sustainability for low to moderate income, new immigrant and farm worker families, providing and facilitating access to healthcare, behavioral health, social service leadership groups, housing rehabilitation, immigration, citizenship assistance, environmental education, and workforce development in a culturally and linguistically appropriate manner, so that people feel welcome always that they come to look for our services that were developed according to their needs that they established. The story of Campesinos, we were a group of farm workers. And my family and I, we get together to establish an organization that help our family in a sensitive way, like people that were like them and that understand their work conditions, that we knew where they were going, and what their needs were. It's how we establish all the services that we have. The description of the outreach with the farm workers, this work, it's being very sensitive to our community, knowing them and being, we are from that community. We come from, we are from these communities, so we know the community, the needs, our parents, families, siblings. So we live it every day. We're from Arizona and Sonora, where the farm workers during the season, it's winter here that starts in September, October, but it's until November and December, until March. We see that they have to, the ones that live in Mexico, they they make like 2 or 3 hours to get the bus, and sometimes they don't even get the bus to get to the farm. So they started like walking at 10 p.m. to cross around 3 to 4 a.m. We saw that need, and it's how we started like going to taking them the information at the time during COVID to make sure that we have the service, the education, all the tests, and everything that we saw that they needed. You can see the pictures that it was like uh, 2, 3 a.m. that it's just starting the sunrise, and they're there waiting for their vaccines or another service of diagnosis to diagnose any disease. We have the opportunity. We come from the farm, from the same community. We have their trust from the farm workers. That it's very important to have the trust that what we take to them or tell them, it's for their good. We're never looking to take advantage of them, but always trying to see how can we help so that they can have an opportunity of being more healthy. And another thing that is very important is that we are the only agency that is at the time in the morning. They tell us that we're crazy or what, because we're working at the time, but we know who are these farm workers, so we're not crazy. It's the type of life that we live. So we have their trust for all the years that we have worked. And here locally, we have the trust from the farm workers and all the companies that allow us access to them, to the farms. You should know most of them. These farms are private property. If they don't allow you to enter, they wouldn't allow you, but because we are part of the same community, and the health promoters are part of the community, they allow us to come into the farms to talk to them. How you can see, we can see their shops. They invite us to take them the education early morning. We adjust to their timings. If they say 2 a.m., if it's say 6 p.m., if it's a Saturday morning, we always adjust to their timings, to their needs. We don't have a different schedule like 8 to 5. When I hire people, I tell them we're not a traditional 8 to 5 company. We are here to fulfill the needs of our people, and we're going to do it at the time that they need it. Sometimes that's why we go to church or schools where they're going to get together. It's where we go in the morning. Now with COVID, we realized that people that were coming here were crossing very early. There are not many resources for farm workers. There's not a public restrooms. There's not a rest area. They cross at 11 or 12 where there's no line to cross, but then they go to look somewhere to just get a rest. Sometimes we know because we're in a desert area. Winter is so cold, and they just gather where they find, and from then they get that information there, and we bring them jackets, quilts, etc., to help them get get less cold. So there are key strategies to get to them. to recruit and serve them. We also represent the culture and we're very sensitive to their needs. We talk like them. They tell them something like about the farm and they make jokes and we understand, so they feel very comfortable. When we have eh, any gifts or presents, they are very thankful. Like it can be a pen or as with the information that we're taking them, they're always super happy to receive it and they always know where to find us in the community. If they have more questions, we work with a promoters, health promotes. We give them the strategies to come back to the community to hand in the education. Another strategy that it's important is a health fair that it's this year is going to be year 28 that we do this health fair. The purpose was to give them all the education of migration and we organize all the community. We have a coalition to service the farm workers. We are like 25 organizations that are all through the year. But that day we bring like more than 60 organizations to give them this all this information. Everything is free, everything, food. We do raffles. It's a farm worker day. It's their day. We started to give recognition to them because in this area it's very important to the ones that visit the snow. There are thousands and all the farm workers that and all the people that also give so much support to our communities and all the harvest. We started this event and now it's 28 years. The first Saturday in December. And this day we realized that more than 60% have a chronic health issue that in one day you cannot give all the service. That's why that Campesinos was established and we give services all the year during different types of harvest that there are, but the strategy to go with them wherever they are and at the time they are is the best strategy to support them and to show them that we're really interested in them. There are a lot of challenges. This year, COVID, they were afraid if they were going to be infected, but the will to help and the compassion for our people is what we decided that we have to do. So we got all our equipment to be protected. Our promoters look like they came from the moon, but they started with all the services, maintaining our distance and teaching them or showing them that we're there to give a service, but we have to get protected ourselves as well. So thank you. I am finished with this. Probably I said very fast all these. I only had 10 minutes, but thank you. If you have questions at the end of the presentation, thank you. Thank you, Emma. Campesinos Sin Fronteras, thank you so much for sharing this practice that it's so important to program service according to their timings. So thank you for sharing all this information with us. Our next panelist, I would like to present Fernando Molina. He is the founder of Peace and Live Today. It's an emotional health worker curriculum for farm workers and that help or serve farm workers.
Okay.
Well, Good morning and good afternoon in some other places, but here it's already evening. I'm impressed with all the work that Campesinos Sin Fronteras do. Like, I'm impressed. I want to know more, and I would like to do some collaboration with them. Like Margaret said, I'm Fernando Molina, and I'm the creator of this is called Vive Hoy. It's a program that tries to create safe spaces to share dreams, challenges, and recognize all the strengths that we have as people, as a community. Vive Hoy, it's a, a program like a that a woman said, it didn't teach me anything new, but it made me realize my past to create a better future. You know, like Emma said in her presentation, many times we have the opportunity to talk to the farm workers, with our brothers, the migrants, and they tell us sometimes with their emotions, but there's not a space to talk where we feel safe and respect. It's why we created these spaces. How do we do it? What we do is we get together in teams, in groups, and then we do some agreements to respect each other. And I like always to emphasize that it's very important to share our story, because to be here, present, alive, is because we have had all the strength to succeed, and we're always need to recognize, like we recognize as people, persons that we are. But when we come out from any situation, we come like with more strength. There's space, is a space to reflect on this. Some challenges to implement the program of Vive Hoy are very similar to the ones that exist in another communities. It's the schedules that farm workers, sometimes all the migrant community work a lot. Sometimes we have two jobs. So we have to look for a timing, very strategic timing, where it works for everyone to get together, so that we can listen and learn from each other. We have been implementing this program in different scenarios with farm workers, with community leaders, and with the common people from the community. And it has had a lot of impact because there are topics that affects all the community. When we get together to talk about these topics, we talk like how to express our emotions, respect through dialogue, to forgiving our past, having good healthy habits, giving value to equity, and recognizing our strengths, analyzing resources that the community has and that we can use them. Emma mentioned that there's collaboration with 25 different organizations helping these farm workers. And this is what makes strong the relationships. We invite in this program that each participant to make a life project. How do you see yourself in 3 to 5 years after analyzing all the resources that a community has, all the strengths that you have as persons? And we emphasize and invite them to celebrate their victories. Anything that they are overcoming, to celebrate everything. The methodology that we use in this program is give a welcome, analyze how do we feel that day, and also recognize what can they share to learn one from each other. What type of message they take to their house, to their homes, to have a good a human development. All these helps that there's more support, mutual support among participants, but that they recognize that it also help another people. This program is very interactive, where we play. When we do an evaluation, I don't know if you have heard about the dance of the chairs. We play to the dance of the chair. The person that is being left out have to answer or share something that they reflected on what was about the topic that we talk about that day. If we talk about like forgiving, how they feel after talking about the need of forgiving. And a lot of games that we used to play when we were kids, but now as adults, but now better to evaluate ourselves, or to feel that we still have a child, an inner child, and it's very important to have fun because it's also part of our mental health. I know this was very fast, but it's basically this to give some just like a small taste of this presentation. If you have any questions, please reach out to us, and I, Fernando, I'm representing the program. I can give you more information. The method, in 2 minutes, an example. When we gather, we always sit in circles so that we can see each other, so everything can be very equal at the same level. And when we get there, if we're talking about an orange, everyone responds according to their culture. Among everyone, it's described. This is the methodology. So everyone has something to share. Any topic. We believe that everyone is contributing with something, not only the one that it's guiding. So thank you. This is a privilege for me to have the opportunity of sharing a little bit of our program, Vive Hoy. We're going to have the opportunity to keep in touch, to create networking. Thank you so much. and have a blessed day.
Muchas gracias, Fernando. Yo sé que este
Thank you,
enfoque y
Fernando.
aprendizaje es muy valioso para
It's very important for mental health of so many communities.
Entonces, muchas gracias por compartir
So thank you for sharing
más información sobre
more
esto con
information.
nosotros hoy. Nuestra próxima panelista es Mariana Blanco.
Our
subdirectora
next
ejecutiva
panelist
del
is Mariana
Centro
Blanco.
Maya Guatemalteco.
She is the general manager of the Guatemalan Maya Center.
Hola,
Welcome.
muchísimas gracias.
Thank you,
Muchas
everyone.
gracias. Perdón
First,
porque estoy
I'm
un poquito
sorry
resfriada, entonces
for my
tengan un poquito
voice.
de paciencia con mi voz.
Be a little
Pero
patient with
estoy
my voice, but I'm very happy to be here
con
with
mis
you
colegas
and with all my colleagues presenting
presentando
and learning from everyone.
todas las estrategias
We are going to
como
talk
decíamos,
about
de
the
nuestro mensaje de texto para llegar a las comunidades.
communication and our text messages to
Les
get
cuento
to the
del
farm
Centro
workers.
Maya Guatemalteco.
I'm going to talk
En
a little
nosotros
bit about this
inicialmente fuimos
Guatemalan Maya
incorporados hace
Center.
30 años en el
We were
92,
incorporated
pero
30
hemos
years
hecho
ago in
mucho
1992,
trabajo,
but we have been
muchos
doing
años
this
antes de eso.
before
Padre
that
Frank,
time.
que es nuestro fundador y
Father Frank was our founder,
era el
and
jefe de
executive
servicios de
director
migración y
was
refugiados en la arquidiócesis del condado de Palm Beach.
he was
Es
in
queda
Palm
para
Beach,
los que no
the head of the
conocen el Centro
archdiocese in
Maya.
Palm Beach, it's where it's our Guatemala Maya Center.
Entonces les cuento un poquito más de cómo empezó este trabajo.
How everything started.
Empezó
Father Frank
hace 50
started
años,
like 50 years ago working
los
with
trabajadores agrícolas mexicanos
migrants, Mexicans in that time.
en Guatemala en los años 80.
And in the 80s, there was a genocide, and all the indigenous from Guatemala started to migrate with a very new culture, all these languages that didn't exist in this county. Father Frank saw all the needs and how can bring access to this community and how can we give them services so that they can have that culture in the center where we are giving our services. So our center and our mission has always been that people define, the families define the services that we need to give in this Maya Center. We started working directly, giving with services to all the moms that were pregnant. Families usually didn't see any doctors, a gynecologist, so those were the first services. But 50 years later, and now doing this work, still the community guides our work. It's just like bring the access. We just opened our clinic, free clinic to all the kids for the farm workers, literature for kids, program to outreach the community that sees like around 1,000 people to people in a year, and we're guiding our work according to what the needs for the community. We serve 28 different people from 28 different countries. We're going to continue to the next slide. We recognize many of those we serve and the population that we work. We speak with people from 28 countries, different countries. We focus on indigenous. We have access to every language that we see in community is Poptic, Acateco, Cochubal, Mam, and it's how we try to give them that information to the families that we serve through our text messages. Sometimes we have only 33 employees and there are so many farm workers in the county. So we thought it was not going to be enough to go to outreach. We needed to think something more innovative to bring them that information to our families. It's where it started, this text messaging service that we use. It's called Simple Texting, and we have 4,500 community members in this service, and we send them for the messages for everything. Like it's how we do our appointments. If we have any events for food, vaccination, any kind of event, we send a text and 4,500 people are reached. We have to understand that most of the families might not have that literature level. So we have to sometimes is send those messages by audio record. We send it in different indigenous languages, in all the languages that we have in the community. The service that we use is called simple texting. I definitely recommend this service. It's very expensive. We always say a higher number because if you start adding more people, it's extra. We approximately pay 15,000 a year worth of text messages, but it has really been worth it. And it has proven to be very successful to teach the community and to provide them services. Every time that a disaster is coming here, like in Florida, or if we have a vaccination event, the only thing we need to do is to send a message, text message, and the community comes to us to get that services. So it's really recommended, an idea that we can give you, because we know that $15,000, it's a lot of money, is to collaborate with another agencies to divide the cost. And among different agencies can use the same text messages for the same community, especially if it's in the same area. In that same service, you can create groups, like for example, to the community leaders, to the ones that it's distribution for food. You can do it to a specific group, but you can reach a lot of people instead of using WhatsApp or different method. Here's an example that we typically use. We usually don't send so long texts because then we lose that information. But I included this message because you can see the different languages. We send it written, and in the bottom part, you can click on the language to hear it by voice. That same message can be heard if they cannot read or if they don't want to read. And to finish, to give this type of service, like through text or voicemails, and hearing all the community needs from the farm workers, what they're needing, giving this access through text message, the same community and the same farm workers have told us that is the best and easy way to give them services, because they're not listening to the radio or they are not seeing Facebook or another way that we send information, but with a text message, even though they get home at 7 p.m., the message would still be in their cell phone number. It would still be there in their phone. So that's it. Thank you very much. The questions will be at the end. I know it was very fast. Thank you for your support. And as all my colleagues are mentioned, we are here to serve you. Thank you, Mariana. You have the ability through text messages and voicemail. It's very important to communicate a natural disaster or any event. Thank you for sharing this. Our next panelists will be Aid Vice, Director of MSAW Services, and William Kinsey, from Medical Director. During their presentation, Dr. Kinsey would be speaking in English, so to the interpretation, if you want to change it, to switch it, please select the glove icon. So welcome, Aida and Dr. Kinsey. Thank you. Thank you for being today with us, Aida Baez. I'm the director of the Farm Workers. This clinic was born serving to immigrants here in Wisconsin, and we have grown. We're very thankful to share our success to the outreach of farm workers during the pandemic.
Aprovechando la colección regional que ya estaba establecida.
All the regional coalition was already established to receive all the farm workers. It was extended to serve the farm workers in a better way during the beginning of the pandemic. A special committee was established, and it was sustained at different agendas.
Como todo empezó bien rápido con
Everything was like so sudden during the pandemic. Every week, the committee was sharing that information, especially because everything was so changing day after day, and no one have had an experience on how to face the situation. So working together was the only way to reach to every people. Each one brought like different ideas, so everything was connected. All the resources of every people that was part of the group, everyone that was involved in the committee, especially in that population. Some key challenges. Everything was changing so fast, so we needed to have a general manager for the project. There was a need to make subcommittees, and the subcommittees that were done were safe access, housing, education, and outreach. The oriented partners part of the group was UMOS, that was an organization that helped the farm workers in different programs like Head Start or housing. Department of Workforce Development, DWD, Public Schools, Legal Action of Wisconsin, Midwest Food Products Association, that were the ones that give employee to the canneries, different health departments that were involved, OSHA, the State Emergency Operations Center, and the Wisconsin Primary Health Care Association, that is WPHCA.
Well, thank you to my colleague, Ida. Appreciate working with you, and it's been so fun here already today to learn from our colleagues across the country. I wanted to talk a bit more about the outreach efforts that Family Health La Clinica provided during the pandemic, continues to provide during the pandemic. We are a migrant health center. In fact, we're the only migrant health center in the state of Wisconsin. And so we provide services across 72 counties in the state. One area where we spent a lot of our resources that first year of the pandemic, before vaccines were available, was using our mobile outreach vans to go to work sites and housing sites for in-person education to the farm worker population. So similar to what you've seen with groups that have presented so far today, we were able to do that at different times of the day, depending on worker schedules, and typically did it again, either at the work site itself or the housing site. Our one of our partners that we work very closely with is the state agency, the Division of Workforce Development. And we work together with them to actually help form the guidelines, which ultimately became a state law. It was the emergency rule relating to health and well-being during the COVID pandemic for migrant and seasonal agricultural workers in the state. With that information, we were able to educate not only workers, but also employers. So went into their work sites and talked about what was safe distances between workers, the importance of masking, hand washing sites, where they should be located, quite detailed information. And then, of course, workers also live in congregate housing, which is a risk factor in and of itself for transmission of COVID. And so we spoke to the details of those needs as well. Here you can see both our mobile unit, where we conduct our clinical services, as well as tents we had set up outside of one of the housing sites. And then a picture of one of our COVID vaccine clinics. Thank you. I think any programming that needs to be stood up, especially rapidly, as Ida was speaking to, depends on funding resources. And as a migrant health center, we were able to receive fundings, the American Rescue Plan Act. And then also one of our partners in the state is the Medical College of Wisconsin, and we received an Advancing a Healthier Wisconsin grant, which the purpose of that was to develop the cohesive response to prevent and minimize the transmission of COVID-19 among our population. So Family Health La Clinica really worked to manage and coordinate these efforts to expand partnerships with the groups we just spoke about. And we saw the number of workers that we had interacted with for primary care services prior to the pandemic, which was about 400 workers the previous season, to over 3,000 farm workers. And with the education that we delivered, with the changes to the work sites and housing sites, and then in 2021, when we gladly were able to start vaccinating workers as well, we found that last season, after conducting over 2,600 COVID tests and 2,500 vaccinations, we had only 18 tests positive last year, less than 1% positivity rate. which we thought was a real testament to the farm worker community in Wisconsin for how engaged they were in taking care of their health, and also kept us from having any outbreaks in the city. So what are we thinking about as we move forward as an organization? Well, the subcommittee that really came together to answer questions about COVID care will continue, and we have a new charter that each group has signed on to, and we will continue to work on new areas of need within the farm worker community. At La Clinica, we use an app called HubSpot CRM, which is basically a database, allows us to update information about each of the work sites and camps that we go to so that we can target ideas for future follow-up as well as to communicate as a team. And we are continuing to expand our community outreach coordinators. We had not had funding for that as a year-round position, which we do now. And we are working closely with other community health centers around the state. Well, gracias, and thank you for your time. It's a pleasure being involved in this presentation.
Thank you, Dr. Kinsey. Now we'll go back to Spanish. To change the language, please select the interpretation globe. Ahora volvimos al español.
We have come back to, you can change on the globe, the language that you prefer. Dr. Kinsey, thank you very much, and Aida, for sharing. I know this clinic is the only one that serves in Wisconsin, and it's very impressive how you have widened all the services for all the ones in Canaries and with animals. Thank you for sharing with us today. We have now our questions and discussion. Liam, it's going to direct this part. Thank you, Margaret. And thank you everyone for your presentation. This has been short, but we have left a long time for questions, and we have several, so it will be okay. If you want to know the answers, please stay with us. We have so many questions. I'm going to start with a general question for everyone. When you work with farm workers, what are some of the considerations necessarily to planify or do outreach that can be successful? Thank you, Liam. Definitely, how I established in my presentations, the trust of our people, it's key to develop any strategy to service them. They don't trust in everyone. They really trust in those that they see there is like a continuous work, always serving and helping in different ways. Typically, they don't trust. Most of the time, they don't trust in any government groups. They don't like to commit. They don't want to have the information where they are working. If their employers are not receptive to that information. That's why we're always trying to see where is they want to get that information. That's why we adjust our schedule to go and outreach them wherever they want to be. And they can talk of any of the circumstances that they face. We see that a lot of the farm workers don't want to talk and access services. So trust is one of the keys to have in any kind of service that we want to offer to the farm workers. Thank you, Emma.
Si Mariana tiene algo para añadir.
Mariana, do you have something to add?
A ver, discúlpenme. Pues sí, sí, la verdad, lo que
It's
mencionaba
very
Emma
important what
actually
my
así
colleague
es.
Emma
Nosotros
just
trabajamos
said.
de una manera muy
We
similar.
work in a very similar way.
La meta aquí, ¿verdad? Es
The challenge or the goal here
hacer
is to provide access and to make sure
dando el servicio que
that we're giving the service that our families need and work in different schedules, always doing the events very accessible. We always do them on Saturday night. Our clinic, it's open during the night to give access. Only saying what Emma has already said, we work in a very similar way.
Muy bien.
Excellent.
¿Quieren responder a esta pregunta?
Does someone else want to add or to this question, or we just keep going?
Okay. Pues voy a empezar en orden que hemos recibido.
Okay, I'm going to go by the order that we have received the questions. Emma Campesinos, someone asked, in the health fairs, what type of services do you provide? On the farm worker day, we basically provide medical services, diagnose, like glucose, cholesterol, we check the pressure, vaccines, flu or COVID, and hepatitis C, hepatitis A. We have a coalition where we all are voluntaries. We don't have a budget for these events, so we all together organize and cooperate. We pitch in all together, and this is how we recruit during the year different organizations that want to bring services, medical services, like dental, vision, mammograms, whatever we can bring. All the mobile clinics comes from another places, but we also have food. Last year were tamales, another days menudo, something that can be a little warm because this is like very late when the temperature is like 30 or 40 Fahrenheit. Here in the desert is so cold, so we have immigrant services, access to education, everything that we can have. We bring quilts, clothes. The employee department during the year, they collect jackets, quilts, different. An area, a huge area, San Luis, the border, San Luis, Sonora. We accommodate everything in a park. All the services that we have and what people asks is what we try to bring them.
Wow. Gracias, Emma. Qué buen trabajo.
Thank you, Emma. Great job. It's almost time to have lunch here in California or dinner. So Fernando, this question is for you, and it's a question in 3 different parts. How do people come to your program, and during how long do you work with them, and how many people do they participate? Okay, excellent question. We do it in different ways. Sometimes identify people that come to us and make questions like, if there exists a program where they can go that to express that they are sad or depressed. And we tell them we can send you to some doctor, and is that like the opportunity to start breaking the stigma? No, we don't want a doctor. We just want to talk to someone. And it's a great opportunity. Oh, okay, great. We can get together different people in group where we can express how are we feeling and to realize that it's so human to feel sad or mad, angry, that we're all exposed to this. It's a great opportunity to educate about mental health. How long? The program is designed for 10 weeks, one session per week, 2 hours every session, because it implies see that topic, analyze it, reflect about it, and make a commitment to change, personal commitment. Next week, we get together, and now they have processed all the change that they wanted to do, and they make an auto-evaluation in the next session. There's another way. It's like a kind of retirement, 2 days, Saturday and Sunday, usually it's how it works. And the idea is basically to see all the topics in those 2 days that are, there are 10 topics. What was the other question? I'm sorry. How many people do participate? The ideal is that 10 to 20 people, no more, because it's very interactive. Who is a facilitator is only facilitating the processes, and it's bringing healing. The person is doing the healing through dynamics, a lot of role playing, fun, but it's very interactive. To live the present is very experiential. That eternal present, we bring the past to the present, and the future we bring it to the present too. So we make it very present. Thank you, Fernando. Mariana, there are some questions about the text messaging service that you have described in your presentation. First, they want you to please repeat the name of the service that you use, and they want to know, how do you know which language send the message, and if you have a limit of characters in the message. Of course, the program that we use, or the system that we use, is simple texting. That service, we send these messages in every language that we have, with interpreters that we have in our community, the ones that we have, the most that we have in our community: Popti, Acateco, Janjobal, Mam, Quiche, Creole, and Portuguese. English and Spanish are the languages that we're sending. It depends on the interpreter that we have available. The system does not have a limit on how many characters you can send, but you're charged for every credit. Like, the longest it is, the longer, the more that you're going to be charged. So, and it is also charged depending on that kind of people, the amount of people that is using. And also, if it's a video or a picture, it charges differently. You're charged for every different thing that you use. So not all text messages are charged the same. It will be depending on the information that you want to have available. Another question: how did you bring up to 4,500 cell numbers? Depending on the outreach services that we do, every people that come to our center to get any service, we have our questions, and we ask them if they want to enroll to our text messaging information. Through the years, we have bring all these many cell phone numbers through all the people that we have served. And the last question: did you show a text and your information, it were the links to the different languages that you showed? Are they links to voice notes? We send the text messages written down in Spanish. And on the bottom, we share the links in the different languages, and those would be voice recorded. They can just read the text, or they can see the language, click on the language, and hear it as a voice recording. Simple text looks like there's a lot of good energy around that. Can you share? Can you please share it on the chat so that everyone can see the website? And we have questions for La Clinica, Aida and Dr. Kinsey. I'm going to say it.
And the most impactful strategies for getting access to the farms and to get to know the managers. Entonces, ¿cuáles estrategias eran más impactantes?
Which strategies were more harder to get access to the farms? And what were the obstacles to get access to the farms and to get access to the managers?
Aida, you could go first and I can follow if you'd like.
I don't know a lot about the story of the agency because I have had like just few time in here, the relation with the employers. To have that relationship is so important because here in Wisconsin, there's a law that we can go to the farms, that we are allowed to, but sometimes the employers don't want us there. I have noticed also we're not notified if they have had exposure to COVID-19. They wanted like to have it as a secret. But for me, to open those doors, the most important is to have a relationship so that they can see that we're here to serve and to help.
Dr. Kinsey?
Right. Yeah, I would agree. And I would say that, you know, La Clinica is now in our 49th year working as a migrant health center. And so we have some very well-established relationships, particularly with some of the larger employers in the state, which allows us good relations and access to that wide sort of base of workers. I would say, you know, we had examples during COVID where we did outreach, doing sort of cold calls to new farms that we've not worked with previously. And we had a range of responses from employers, you know, some that were very excited to have the chance to work with us and provide those services for workers, and others who were very unhappy that we were reaching out to them. They did not want COVID services, did not believe in the vaccines. So as a team, we continued to remind ourselves where our responsibility is, which is always with the workers. And so we had examples of where we were then able to go out and meet with the workers directly. And for instance, if there was a housing site at a local hotel, then we set up our COVID vaccination clinics in the parking lot of the hotel. So we saw all types of responses, but our long experience working with different employers across the state really came invaluable when these new challenges arose, and we needed to create new programming and new responses to meet the needs of farm workers here in Wisconsin.
Thank you to both of you. Y bueno, gracias a los dos. Y quiero
Thank you both. And I want to give the opportunity to every one of the presenters, if you want to respond, which are the obstacles to get access to the farms, or which are the strategies more important that you have to get access to the farms, or to keep relationships with the managers or the employers. I can mention, like, the relationships that have been established with the companies are very important. Have a good relationship. You're interested, have a very healthy people working with you. So I'm also interested in having healthy people. So it's how we start a conversation, because there are many differences. So there are different political differences. They don't trust. Cesar Chavez was born here in this community. There's no much trust to any agency, nonprofit organizations, because they think that we're coming to organize people. So we have to be very smart and to have a good relationship with the employers and to the employees. And how our colleague mentioned, we go to where they are early morning, or to church, or to sometimes where they're not working. And that's the way that we do the outreach. And employers, sometimes they know that they're getting services with us. If it's not through them, they wouldn't say anything. Don't ask, don't tell. They didn't want it to be involved, because if their employers would be infected, then they would have to stop the harvest. So they prefer just not to do anything. Sometimes they're a great resource for you, and sometimes they're an obstacle for our organizations serving that population. We have time for one more question. Dr. Kinsey?
Why did you decide to use HubSpot CRM? And can you talk a little bit about what the program allows you to do and how it has worked out for you?
I was just going to respond in writing to the question about the database that we use, the HubSpot CRM. So we worked with other community health center partners just to get input on what had worked for them. Of course, we had to consider costs, but the benefits of HubSpot for us, beyond what we had been using, which was basically an Excel spreadsheet, was it gave us better communication tools amongst our own team members at Family Health La Clinica, but also email lists and other communication tools to reach out to both employers and workers, with a monthly newsletter, for instance. And so it expanded our capabilities for communication internally and externally at a reasonable price.
Great. Thank you. Thank you so much for that explanation. And was Ida, did you want to add to that?
Yes, if you don't mind. Something else that I've noticed as well is that it allows you to not call that employer twice. So it documents and keeps track of that communication, so that employer's not hearing from this outreach worker or this person and this person. So it's keeping track of all that communication. So that way that the employer or whoever we're communicating doesn't feel bombarded with what we have to share. So,
great.
Thank you.
Thank you. Gracias. Y gracias a todos ustedes, los participantes. Yo
Thank
creo
you,
que
everyone, participants. This has been a great Q&A session with more questions and more energy that I have seen in all the seminars, webinars that I have been present. Thank you so much. Sorry if we have not answered your questions. You have all the contact information for the panelists. So if you want to follow up with any one of them, or if you want to do any other question, you can see in the screen, you have the emails, some phone numbers to keep in touch with them.